It's a very important topic, which actually most of us as a physician also don't pay much emphasis. And we do bother about our patients, but then we forget to, look at this aspect of their illness. So when I was going through the literature, I came across a date that is 15th of June. And what is this 15th of June famous for? So I tried to search for the literature on the Google, and I could find that 15th of June was used, or maybe it was designated as Nature Photography Day. It was also maybe National Smile Power Day. It was also known as National Lobster Day somewhere. But lower down, I could find that it was World Elder Abuse Awareness Day. So that is the importance which we give. So it should have rather been on the top. That is, the Nature Photography Day should have come down, and World Elder Abuse Awareness Day should have come up. So this is basically a day which was basically voice its opposition in the to any form of abuse of the older generation. And this was initiated by the International Network for the Prevention of Elder Abuse in 2016, and then it was taken up by the Nations Day and in the General Assembly by a resolution. So now we celebrate this day as the World Elder Abuse Awareness Day, and the theme for this Elder Abuse Awareness Day this year would be bold, age with attitude. Now this theme itself indicate that the awareness about this topic, or maybe the even the voluntariness of the elders to present themselves and to claim that they have been abused is so less. They need to be bold, they have to live with an attitude, and they have to come forward. And in spite of them, rather we have a responsibility as a physician to take care and go, make a first move and ask them about these questions. So as it has been reported earlier, that this elder abuse is basically just the tip of an iceberg. So in US, it was studied that for every one case of elder abuse which has been reported, there are rather 23 more cases which have not come under any highlight, or they have not been reported. So when we look at the definition of elder abuse, it becomes even more important with women's health. When we look at the definition of elder abuse, it is a single or a repeated act or lack of appropriate attention where there is an expectation of trust that leads to harm or distress to another person. So it may be an act of omission, it may be an act of commission, it may be intentional, it may be unintentional. But if it is causing a harm to an elder person, it is labeled as an elder abuse. So, as I've told you, the prevalence is not well established. There are various studies which have given wide prevalence. The WHO has estimated it to be 1 in 6 people over the age of 60 years suffer from elder abuse. And nearly around 141 million people are affected globally. The estimate may be much less than what it is actually present. In US, it is 1 in 23 cases which have been reported by the authorities. When we talk of India, there have been various few studies here and there which have looked for the prevalence, but it has been seen that it ranges between 9.6% to 61.7%, with an overall average prevalence of around 72%. And when you look at the Help Age India report, research report, which is an organization which is actively working on this aspect. They did a survey in 2015, and they inquired, or maybe asked questions to young adults, and they found that almost three-fourths of the adults were accepting the fact that the problem exists. And there was almost 72% agreement to that the elder abuse exists in some form or the other. And when you can see that it is overall, all over India, the results were almost the same. All young adults agreed to the fact that there was a problem which was related. But when we look in our OPDs, normal OPDs, we hardly find any patient who has been accusing or who has come forward and has told us that the patient is having some sort of elder abuse. So now, what are the types of elder abuse? Well, we all are aware of physical abuse. Now, physical abuse is something which is easily appreciable. It can be easily picked up. But even that is hidden by the patient, because they would come and tell you that, okay, I had a fall. I had this injury because I fell down. I had sustained trauma while I was moving around. But then you will still get some clues that those injuries are not related to are not related to any accident, but rather it was infiltrated by some abuse which the patient might have had. The other forms of abuse are sexual abuse, and which may exist even at that age, an elderly age. And the other, which is the most common, is the emotional or psychological abuse, which may be in the form of a verbal abuse, using an abusive language. The patient may be, the elder may be stopped from attending any physical meeting somewhere, or maybe he may not be given adequate medications, and which may induce pain, anguish, mental trauma to the patient, and increase the distress of the victim. So, this is the most common type of abuse which is commonly seen but very less reported. Then there is neglect, which is again a common thing which is there. Around 50% of the patients would be having neglect. And especially those who are dementia or the patients who've had stroke, they may be neglected. You may find people having soiled clothes. You may find people who are not being taken care of. They are not getting appropriate medication. They're not being given appropriate food. And this may be because of the neglect, because it adds to the responsibility of the caretakers. There may be financial exploitation, not just by the son, daughter, or daughter in law, but then even grandson and granddaughter may call up. They may just call up, Grandpa, I'm just stuck somewhere. Can you please transfer 2,000 rupees? And this could be a fraud which could be done and can lead to financial exploitation of elderly. There could be healthcare associated fraud. Well, as physicians, we are there to treat patients, we are there to take care of them. But then maybe few may overcharge the patient, do not give appropriate treatment. They may not have an ethical practice, which may also be accountable to an elderly abuse. So we have to take care that all these things are taken care of, and we have a keen eye and try to look for this. So when there was study which was that 50% of the patient had accepted that they had some sort of an abuse, and especially it was verbal abuse or talking rudely or not taking care of. But then other abuse were also predominantly seen in the overall picture. What are the risk factors? Well, risk factors could be advancing age. As the age advances beyond the age of 80, they become more dependent. Female sex, we're talking of women health, they are more prone for this elder abuse. Disabilities like dementia, depression, history of a fracture, patient having bedridden state, patient of a stroke, they are all dependent and they will have an elder abuse. We have socioeconomic status, unfavorable caretaker patients who have been had person who have had child abuse, they are all likely to have an elder abuse. Patients, it is unfortunate, but then 90% of the time, it is the family members of the patient who take them to elder abuse. And that is especially seen in patients, caretakers who are having financial dependence on the older adults, or they are unemployed, they are having alcohol dependence, or they are having a violent behavior or depression. These family members are more likely to cause harm to their elders and are more likely to cause some sort of an abuse, especially in the form of a neglect, and which has to be taken care by us. Now, when we look at the role of a physician, well, our role is definitely to treat these patients, take care of them, treat their illnesses. But then, when we talk of a physician, it is very unfortunate that we do not report the elder abuse. We do not have a keen eye in reporting them. So we need to identify elder abuse, report them, treat these patients with dignity, have a policy document, develop guideline which may take these elder abuse. So when we look at the elder abuse reporting in an emergency department, it was even lower than what it has been reported in the community. Whereas we, as a physician in emergency department, if we have keen knowledge and are well aware of the fact, we should be able to report more elder abuse. And this was seen that it was because of insufficient knowledge, inadequate training, and poorly organized systems of reporting. Maybe legal implications, fear of legal implications could also be responsible for it. So, what is should be our approach in elder abuse? Well, we should have a first and foremost is high degree of suspicion. When we have a patient in our OPD, we have to look at subtle signs which may indicate we may be wrong, but at least we should then put some direct questions which will help us in identifying these patients of elder abuse. We have to have a comprehensive history and physical examination, especially to those who have these complaints, who are elderly, who have had strokes, who have poor socioeconomic strata, who are dependent on this, who have some unfavorable characteristics, of especially the caretakers who have shown that they have shown a financial deterioration. A patient who was affording a medication has suddenly stopped affording the medication. There could be a incidence of financial abuse in that patient. So we have to have very keen interest in identifying these things, and then only we'll be able to identify and report them. Of course, physical examination would definitely, warning signs would give us a clue that the patient may have elder abuse, and we have to then look for those things, especially malnutrition. There could be signs of dehydration indicating neglect. There could be fractures apart from fracture of the wrist, thigh, and hip. It may, any other fracture may actually help or should suspect that the patient may have elder abuse. We need to specially take care, look at the pressure ulcers. Whether the patient has been kept bedridden for a very long time would indicate that again neglect of that patient. So these physical examinations are very important, and this will help us in identifying a patient of elder abuse, and we can then directly look at it. Now, these are a few studies which have been done, which have shown that accidental injuries are different from those inflicted. So we need to have knowledge of these things, and this will help us in identifying that the patient is abused. There could be ulcerations, bleedings in genitalia, which may indicate sexual abuse. There could be subtle symptoms. That's like I've given an example. The patient was able to afford a medication, or even sometimes the patient was a person who was happy-go-lucky, had during his working days he was attending meetings, parties, and suddenly has now stopped attending all those things because he has now some financial constraint, or there has been a transfer of property which he has told you. These all things would indicate that the patient may have been financially abused, and we need to take care of these things. So guidelines are there. We cannot just
Udit, can I please request
I'll
you
just
to
sum up,
take?
ma'am. I'll just sum
Okay.
up. Yeah.
Okay.
So there are some guidelines which we need to look into the things. There are some investigations which may not be definitely true in all the patients of elder abuse, but we can definitely look for malnutrition. We can look for some signs of dehydration, hypernatremia, which will be able to tell us. As I've told you that there are no standard gold standard screening tools, but there are a few screening tools which have some sensitivity, but specificity may not be there. But we need to ask some direct questions, and these direct questions will help us in identifying these patients who are abused. So, as a physician, lastly, what I would like to say is that as a physician, it is our responsibility not just to treat these patients, but what we have to do is we have to work in conjunction with social organization, health organizations, social workers, community agencies, identify these elder abuse patients, treat them, take definite photographs and document those things, because ultimately it is something which has a legal implications. There are websites which have been developed by some states in India. Similar websites can also be developed by other states, which can directly report. There are some legal laws which are available in India. So at last, what I would say that with the changing modern, fast-moving life and vanishing traditional practices in which we used to have a close-knit family, we are moving towards nuclear families. The chances of elder abuse are ever increasing, and we need to have a definite look out for those things. And as a physician, it is our responsibility to keep a keen eye, and that would come only by increasing our knowledge, having a keen observation, and asking direct questions to our patients and reporting it fearlessly without considering the legal implications which the patients will be having. So, as a senior citizen, they are the most cherished, actually, people who are there with us, who have great experience and wisdom, and hence we should revere them. That they should be this rich resources should be utilized by us, not rather than harming them at all. Thank you so much for patient listening and giving me the opportunity to talk on this important topic. Thank you so much.